Hello, and welcome. Today, we are diving into a condition that can be surprisingly tricky to pin down, shingles. Figuring out if you have it isn't always cut and dry, but as you're about to see, catching it early is absolutely everything.
All right, let's start with a little test. Take a look at these two pictures. On the left, you've got a pretty gnarly-looking rash. On the right, something that looks way milder, right? So which one is shingles? Well, the surprising answer is both of them are. And by the end of this, you'll understand exactly why recognizing both of them is so incredibly important.
So before we get into the tricky cases, we've got to understand what a classic or textbook case of shingles even looks like. This is going to give us our baseline.
Okay, here it is. This is the classic look. These clusters of small, fluid-filled blisters. We call them vesicles, all on a reddish patch of skin. This is the picture most of us, even a lot of doctors, have in our heads when we think about shingles.
This image shows two other defining features. First, the rash is almost always unilateral, which just means it only shows up on one side of the body, left or right. Second, it follows this distinct band-like pattern, almost like a stripe. That's because it's tracing the path of a specific nerve. You can see it so clearly here on the torso. This is shingles playing by the rules.
But here's the problem. Shingles doesn't always play by the rules. Sometimes the way it shows up is, well, atypical. And that's where things get really confusing. And unfortunately, where diagnoses get missed.
Hey, remember this picture from the beginning? This is also shingles. But just look at how different it is. There are no big, dense clusters of blisters here. Honestly, it could so easily be mistaken for a few insect bites or just some minor skin irritation. This subtlety is exactly why some cases fly under the radar in those critical early stages.
And it's not just the pattern that can throw you off. The blisters themselves can look totally different. I mean, look at this rash on the finger. It looks more like red raised patches, and you don't really see those classic distinct little bubbles. Without a really careful look, this could be misdiagnosed as something else entirely.
So here's the key takeaway. Because these atypical rashes don't scream shingles at you, they carry a much higher risk of being misdiagnosed. And this is why seeing a specialist, like a dermatologist who's trained to spot all these weird variations, can literally make all the difference in the world.
Now, the next challenge is the lookalikes. It's not just that shingles can look strange. Other skin conditions can look remarkably similar. You end up with a real case of mistaken identity.
Okay, so on the left here, we have an early shingles rash where the blisters haven't really fully formed yet. And on the right, that's contact dermatitis, maybe from poison ivy or something similar. I mean, at a quick glance, they look incredibly alike, which makes it really tough to diagnose based on appearance alone.
And get this, you can't always trust the sensation to tell them apart either. We all think of shingles as being super painful, right? But in the early stages, a patient might only complain that it's itchy. And on the flip side, we think of contact dermatitis as just an itch, but it can actually cause a stinging or tingling pain sometimes. The symptoms totally overlap and can really throw you for a loop.
All right, let's raise the stakes a bit. While any case of shingles needs medical attention, where the rash shows up on your body can dramatically increase the risk for serious long-term health problems.
When shingles appears on the face, especially near the eye like you see here, it is a major red flag. The virus can actually get into the eye itself and lead to some severe complications, like keratitis. That's an inflammation of the cornea, which can seriously threaten your vision.
Another really high-risk area is the ear. When you see blisters like these, either inside or around the ear canal, it's a huge warning sign for a very specific and very serious complication.
This is what's known as Ramsay-Hunt syndrome. The virus attacks the facial nerve right near your inner ear, and the consequences can be just devastating. We're talking about facial paralysis, often on one side of the face, plus hearing loss and severe dizziness. This really drives home why shingles in certain places is a true medical emergency.
And all of this brings us to our final and honestly our most important point. With shingles, time is absolutely of the essence. There is a critical window for treatment that can be the difference between a pretty straightforward recovery and facing complications for months or maybe even years to come.
This is the number. This is the one I want you to remember. 72. 72 hours. That's just 3 days. That is the critical window. To get the best possible outcome and slash the risk of complications, antiviral treatment has to start within those first 72 hours of the rash appearing.
And here is exactly why that window is so crucial. This quote gets right to the heart of it. Delaying treatment dramatically increases the risk of developing something called postherpetic neuralgia.
It's a fancy term for persistent and often debilitating nerve pain that just sticks around long after the rash itself is gone.
So you can see the chain of events pretty clearly, right? A delayed diagnosis, maybe because the rash looked weird or was mistaken for something else, leads directly to delayed treatment. And missing that 72-hour window means a much higher risk of chronic, life-altering nerve pain. This is why getting that early, correct diagnosis is absolutely everything.
So we'll leave you with this thought. When a new rash pops up, sure, it could be an insect bite, it could be a simple irritation, or it could be something more. But given the risks we've just talked about, isn't it always worth finding out for sure? See a doctor early, it really could make all the difference. Thanks for watching.